Working in a busy health centre pharmacy, we had to manage the situation quite quickly or risk our service collapsing. With practice changing dramatically and at quite a fast pace, we took rapid steps to minimise the risk to both our staff and our patient base. We wanted to ensure that we can maintain our core services for the community at that challenging time. In the space of a weekend in March, we organised the construction of temporary stud walls and screens and hatches at our counter to provide a safe and physical barrier between our team and the public. We installed an intercom in the pharmacy with a speaker outside so that we could communicate with those waiting in the queue outside. We reached out to our community via our social media platforms, explaining the changes and how they could manage ordering and collecting their medications, and requesting patience whilst we navigated through those first few weeks. At short notice, we brought on board some extra staff. This was to manage the massive increase in prescription volume, to help with crowd control, to manage hand sanitising stations, to help with the cleaning schedules, and also to deliver to those that were shielding. There was a change in opening hours. This was an action that was facilitated by the board and the department, and it allowed us to close from 9 to 10 in the morning to the public and again at lunchtime. And this protected time allowed for us to carry out a deep clean and to catch up on our workload. A cleaning schedule was organised within the dispensary, and the dispensary and retail area were cleaned down every hour. Maintaining sufficient stock levels placed an enormous strain on the pharmacy team, especially in the early stages, and the extra staff helped to manage that. We would usually employ a system of ordering generic lines on a monthly basis, and we would keep quite a bit of stock to hand, but the prescription volume was relentless, so this was depleted and our daily orders increased massively. We were also faced with shortages and quota issues, which took time to resolve, although most of the wholesalers were understanding. I felt there was an unprecedented demand on our services, especially over the first number of weeks. Workflow within the pharmacy shifted dramatically, and whilst footfall remained very high here and script volume increased, massively, the pharmacists were also dealing with an increase in telephone queries or patients presenting to speak to the pharmacist when they couldn't access their GP services. And this in itself caused additional workforce pressures at a time when many members of the team were dealing with their own personal COVID challenges. And we have a big team here in the pharmacy, so in order to socially distance and protect our staff, we had to split into two teams. This was to ensure that if one of the teams were affected by the virus and potentially had to isolate, that we still had staff to maintain our service. Our pharmacy teams worked on alternate days so as to limit contact between the two teams. Temperatures were checked daily, and there was a deep clean done at the end of every day. But staff had to work 12-hour shifts in order to cope with the workflow. On the less busy days, we were then able to concentrate on our MDS workload and prepare for the weeks ahead. And we also dealt with the nursing home dispensing on those days. I thought there was an increase in demand for MDS packs, what with the restricted access to family and carer support. But unfortunately, we had to suspend our numbers. It simply would have been unsafe to take on anymore. We also saw an increase in demand for palliative care medicines, so we had to increase our stock accordingly, and on a few occasions we had to refer to the local palliative care pharmacy. Because of the restricted access to GP services, the board also commissioned a brilliant emergency supply service, wherein a pharmacist could write a prescription for patients' repeat medications in a situation where a GP prescription couldn't be furnished. A number of our pharmacy branches benefited from that service. For example, when a surgery had to close for staff testing. Since lockdown, we've reopened our retail area within the pharmacy, but we've kept our screens and hatches to protect our staff from patient contact. We've also restarted some of our services. We're now supervising our substitute prescribing patients, so we've had to adapt our consultation rooms, and we've had mobile screens made for them, which will also facilitate other services restarting, like minor ailment scheme, smoking cessation service and the flu vaccine service in time. However, we still have phone and Zoom consultation options in place where needed, and this would save patients having to clean down after patients access those services. I feel we dealt reasonably well with the first wave, and I think the changes we put in place were satisfactory. through and managed to keep our staff and our customer base safe. I doubt we would change much in the event of a second wave, but we learnt a lot, mostly about how to handle public expectation and to manage our workload more efficiently. And we at this stage are looking forward to the reintroduction of the pharmacy services and seeing how best to manage them.